Welcome students to the next episode of Learning with Lafferty. So within this video I'm going to be talking about the nervous system. So I'm going to divide the nervous system into the spinal nerves and that spinal cord that the nerves are going to come off into. And then the second half of this video I want to talk about the brain and the cranial nerves. But can't forget about Manny. He has joined us today again. I'm not going to be doing too much with you, unfortunately, again today, Manny. We will eventually get to you more. But definitely important to be thinking about that the nervous system controls everything that the body is going to do or not do. So when you're thinking about the nerves and someone gets under your last nerve, but a manatee will never do that, we're going to be thinking about these parts of the nerves itself. So what does the nervous system do? Okay, so the nervous system is going to do the following. It's going to control and it's going to communicate. Okay, so think about the lack of communication and the problems that can come from that would be, in this case, a lack of control. Now, number two, it's going to detect things that are around us. Okay, such as when I'm touching things and holding things, I'm feeling that, and that sense is going to go to my brain and or my spinal cord. It's going to interpret, so your brain then the spinal cord is going to interpret what's happening, and then it's going to send a response back to an effector, which is an organ to determine what is happening. Oh, I'm touching Manny itself. Now, the third thing that the nervous system does is going to generate reactions based upon impulses through these various nerves. Now within this video, like other videos that I've had, you're going to see some demonstrations, some demos, okay, within the video that's going to help you to visualize what these nerves look like. Okay, they look very similar to, we talked about muscle fibers. Okay, they're going to have coatings and stuff just like that that we'll get into here in a few minutes. Now, when you're thinking about the nervous system, you really need to be thinking about breaking it up into two different, very separate, even though they are connected, but separate divisions, okay? And they call them the structural and functional divisions of the nervous system. Now, the first one is called the CNS, which is Central Nervous System. So that consists of two main parts that are directly connected, your brain and your spinal cord. Okay, that's the central nervous system, better known as the CNS. Now the second division is called the PNS. Okay, now PNS stands for peripheral nervous system. Now peripheral nervous system are all the nerves that connect to your brain. Okay, remember the brain's a part of the central nervous system, and all the spinal nerves that directly connect to your spinal cord. So brain and spinal cord are central nervous system, and everything else literally is going to be the peripheral nervous system. Now there is another little branch that comes off of your peripheral nervous system. So from cranial and spinal nerves come what they call the somatic and the autonomic nervous system. Okay, better known as the automatic nervous system. Now the somatic nervous system that comes off the peripheral side is going to control the voluntary muscles. So think back to the muscle tissue that we talked about in previous videos of the only type of muscle tissue that we can control. That's voluntary. And that would be your skeletal muscles. So the somatic, S for S, controls your skeletal muscles. Now the autonomic nervous system controls its involuntary. So heart, smooth muscles, and your glands, okay, throughout your body. So two different parts of your peripheral nervous system, somatic and autonomic. Okay, those two are very, very important. Now with that said, your autonomic nervous system can also be called the visceral nervous system because its effectors are smooth muscles. Okay, so very important. I'll get into depth here after a little bit of exactly what the autonomic nervous system is going to do. Now every system that we have talked about, we always have to go back to what an organ is. An organ is a group of, should have said tissue, and then a group of tissue is coming from a group of what? Cells. Okay, so cells we got to talk about. Okay, so the first type of cell in this system that does all the work is called a neuron. Neurons are very important because they do all the communicating for the nervous system. They transmit electrical signals, and they have a very long shape that makes them very delicate. Now, one thing also about neurons to think about is neurons are one of the cells in our body that does not always go through mitosis. Okay, remember, mitosis is a regenerating. Okay, so mostly within this system, when a neuron is gone, this type of cell, it's gone for good. Now, there are some cases where there can be some mitosis, some regenerating of neurons, okay, but for the most part, you think about conditions that we have of once the neurons have been severed and they are not getting the blood supply, not getting oxygen, and they have died, they're not coming back. Okay, that's something to definitely be considering. Now, one thing I want to also mention, kind of backtracking a little bit first thinking, is when you're thinking about the central nervous system, the peripheral nervous system, with these neurons, they're going to have the same job that they're definitely going to do within the systems, okay? So even though you have a division between central nervous system, peripheral, neurons are neurons, okay? Now, they may have different shapes to them. Most books, including this one that I'm using, have this general look to them. But they can be longer, shorter, fatter, wider, okay? But definitely know that the structure part is going to stay the same, okay? But sizes could change a little bit. Now, cell body, dendrites, and axon. Okay, there's three parts that are very important for you to understand. Dendrites is receiving the information from the senses throughout our body. Okay, so such as touch and pressure and feel and smelling and hearing and seeing, all those senses that I'll have in my next video when we talk about the sensory system. So dendrites receive the information to a neuron. Individual cells now. Okay, neurons are individual nervous cells. So the second part is the cell body. So that's going to hold the nucleus. Okay, and if you know anything about the cells, remember the nucleus is going to be the part that is going to do the controlling. Okay, so information from the dendrites comes to the cell body. And then last name is axon. Now, axon is going to be that area that is going to carry the information to the effector. Either it be one neuron meeting another neuron, okay, at a synapse, or it'd be a neuron, a nerve cell, meeting a tissue, a cell, at a certain organ itself. So neurons are born with no coatings, no protection. Now, we'll talk about within this video and some other types of cells within the system that help to protect these neurons. Now, neurons on those axons, a lot of them have a coating, a fatty white material called myelin sheath. Now, that coating is coming from a neural glial cell. Okay, we'll look and I'll talk about those here just in a few minutes. So neurons, the tail, the axon, a lot of them have the white fatty material called myelin. So the sheath is going to help protect the axon so the information from the cell body can go all the way through. And think of it as the coating that goes, think of an extension cord that helps protect the wires inside, the fibers inside, from getting damaged. And think about what happens if that coating isn't there, the electricity won't get from point A to point B. So areas within your body where you find gray matter and you find white matter, what you're seeing in the white matter throughout the body, in the brain, spinal cord regions, those are going to be the areas where the axons are myelinated. Okay, so when you hear the word myelinated, it's a special type of cells within our body that are coating the axons on the neurons. About what a neuron looks like. So, of course, you'll notice a couple things here. First, we have Manee's little cousin, George. And George is very close to touching these things that are coming off of a neuron. So this guy here is a neuron, but there are three main parts that you need to be aware of. Now, the things that are coming off that looks like a bad hairdo. And remember, this is one cell, okay, one nerve cell that sends information to control the body through impulses. So these gold things are going to be dendrites. Okay, so the dendrites that come off of this part here in the middle is called the cell body. So the dendrites come off the cell body, and as George comes up and touches one of them, it's going to send an impulse. And you kind of notice that when it hits it, okay, how vibration kind of comes through. Those dendrites collect information and send that information to the main control center. Now I placed a little thing here that would be the cell body. That would be the inside part of it, called the nucleus. And if you remember anything about the cell video, you know that the nucleus controls the information. So as the information is relayed to the cell body, okay, and that cell body then is going to send that information to the nucleus, and then that nucleus sends that information down a thing called the axon. Okay, so this is the axon, which is the tail, and there are different sections of it. It is coated in the white myelin coating, okay, the myelin sheath coating that I talked about within the video. And it's very important to understand that that coating gives a white look to the neuron far as that axon, and that's where the information is transmitted to another neuron or the effector organ that it's going to affect. Now, one thing I want to stop here and talk about when we think about neurons is, remember, neurons are one type of cell. And even though there are different types of neurons in our body as far as the jobs that they do, some of them can receive information to give it to the brain and spinal cord. Some of them then will kind of intermix and talk between the neurons. And then there's a third type of neuron that's called a motor neuron that sends information from the brain and the spinal cord. Now, neurons themselves being one cell, when we talk about the nervous system, we talk a lot about the nerves. Like, probably you've said to somebody, you're getting on my last nerve. Okay, now nerves themselves are going to be a whole bunch of neurons. Okay, so neuron fibers, okay, those axon and the dendrites, okay, now the whole part are collected into a bundle. Okay, now those bundles are called the nerves. Now we change the names just a little bit depending upon where we find the nerves. Now a nerve is true for spinal nerves, cranial nerves, but if they're a tract in our brain, okay, that bundle then is called a tract. Okay, so definitely when you're thinking about neurons, definitely understand there are different types, but the parts are going to be the same. The name will change slightly depending upon a nerve. Cranial nerves, spinal nerves are still a whole bunch of neurons. A tract would be still a whole bunch of nerves, but that's what they call them within the brain themselves. So definitely when you're viewing nerves, definitely view them like electrical cables, okay, with many, many fibers, many, many wires within. As in muscles, those individual fibers, okay, are bundled together into fascicles that are connected tissue that surrounds them. And the names, again, of the connective tissue layers, just like muscles, but they have the root name of neuro. Okay, remember, neuro means nerve, and they just change it with muscles. Remember, they put myo at the beginning, but the endo, the peri, the epi, okay, still the same. Okay, endo in this case would cover the individual neurons. Peri would cover that whole fascicle, and then the epi would cover the whole nerve itself. Now, we had the neurons. They're the ones that do the job, all the information, okay, that's being communicated. But, like I said, they're born with no coatings. They're not protected. They need somebody to protect them. They need some bodyguards. So that's where we step into this second type, okay, of cells within the system called the neural glia or the glia cells. Now, the neurons only make up about 10% of all the nervous tissue. Think about that. Only 10% is what makes up the cells within the system. That's crazy when you think of the numbers. So 90% of the cells within this system are these neural glia cells. So glia, the word itself, comes from Greek that literally means glue. Now, these 5 different types of cells. Now, some textbook kind of leave out one of them, and it talked about it earlier in this book when it talked about the myelin coating, the Schwann cell. But there are 5 main cells that protect the neurons. And again, you're going to have a lot more of these guys. They don't send the impulses. They are all about just protecting those 10% of cells that truly control everything within our nervous system. So the 5 type are as following: astrocytes, Schwann cells, oligodendrocytes, microglia cells, and ependymal cells. Okay, the ependymal cells are going to be the ones that are going to make cerebral spinal fluid. Microglial cells are the ones that are going to do phagocytosis. Oligodendrocytes and Schwann cells together, those are the ones that make that myelin sheath coating on the axon. And then astrocytes are the most abundant, most numerous, and those are the ones that are going to nourish and take care and also build a wall called the BBB. Now next you're going to see a little demonstration of what those cells look like. Now I'm going to talk about the 5 different type of neural glial cells, or glia cells as they're called for short. Now remember that the neuron itself, okay, so this guy right here is the neuron. The neuron is the one that sends the nerve impulses. It's these other guys that we're going to look at that protect the neuron. So let's start with the first one that makes the myelin sheath coating on the axon is called oligodendrocytes and Schwann cells. Okay, so this cell, there's actually 2 different types that makes this coating that's going to protect the axon itself. So that is the job of the oligos and the Schwann cells. Now the next type of cell is called the microglia cells. Now as you can kind of see something sticking out of its mouth there, that would be like a bacterium. So the microglial cells are the cells that do phagocytosis that are going to protect things that are trying to attack our neuron. Okay, so very, very important. Now the next type are the astrocytes. Now if you notice it's kind of holding on to our neuron. Okay, so the astrocytes are the ones that also make this thing called the blood-brain barrier to protect our brain tissue. So it's going to be a wall that prevents things from getting, hopefully, not to our brain. Okay, the brain tissue itself. So astrocytes help to hold on, nourish, support our neurons. And the last but not least, these cells are going to be the ones that are going to make our cerebral spinal fluid that's going to help again to protect our brain tissue. So definitely know that you have a lot more of these guys, okay, your glia cells, than you do your neurons. You know, in estimation, there's, over 80 billion of these neurons, and you have a lot more, especially the most numerous, which are your astrocytes. So definitely, hopefully you can visualize that these guys are protecting your neurons throughout your body, but they do not send nerve impulses. That is the job of the neurons. Now, one thing to remember about neurons is they have to convey their information to another neuron or to a effector. And again, an effector is just a group of cells, that's a group of tissues, hence an organ. Now, I want to use a couple of my little friends here to assist in the process, Mama and Baby and Manee. Okay, so Mama and Baby have got something they want to say to Manee. They want to talk to Manee. Well, if Manee's not paying attention and not listening, then no information is going to be relayed to Manee, and he's not going to understand what he needs to do. But if Manee is listening and paying attention to Mama and Baby, the message then can be relayed to Mama and Baby to Manee. Now, the body's kind of the same way, except for obviously we're not talking, we're using chemistry. Now, in the world of the nervous system, the communication is done through electricity, okay, so electrical currents. That's what's going to convey the message from one to another. Now, another name that it can also be called is action potential. Now, the ions are what is going to relay that information from one to another. Now, sodium and potassium are the 2 main players, but one thing to also understand that we also have some other ions that are negatively charged that like to hang out a little bit more with the potassium. Now, if you remember kind of areas, and I'll use Manee as a demonstration here of him being the cell, that sodium is a positive ion. It's a cation, likes to live in high numbers on the outside of the cell. Okay, on the inside of the cell is potassium. Now, if you remember anything far as ions, okay, in homeostasis, the body is always, as far as gradient wise, loves to do high number to low number, okay? So in this case, high number to low number would bring in more sodium into the cell. So when we're thinking of the world of gradients, high to low concentration. But the problem in this case is, remember, there are doors, there are gates, channels that are preventing that gradient change from happening. So I can't just naturally go from a high number to a low number. And if positive, okay, also on the inside, potassium would come out on a regular basis, then we're not going to have any nerve conduction that's going to happen. So there has to be that separation. Now, potassium, because of its nature, living with more of those ions on the cytoplasm, so that's on the inside, is going to cause a negativity. But we've got to reverse that. We've got to get the outside to be more negative and the inside to be more positive. Now, naturally, potassium can come and go, okay, through those gates a lot easier than sodium can get through those gates. But there has to be some type of stimulus that occurs. And once that stimulus occurs, it starts to open those gates, okay, those doorways. So it'd be like giving him some salt and say, hey, consume the salt. Then as that salt rushes in, that is what we're going to be called a depolarization. And that depolarization state then is going to allow that potassium channels then to open up and allow potassium, and then that homeostasis is going to occur. And as soon as that happens and that information is relayed, it's almost like if you were at a stadium watching a ball game and someone started to do the wave. Okay, so one person does the wave, the next person hopefully does the wave, and before you know it, that has gone straight down the line. As quickly as those gates open, as quickly also as those gates close. But then that presents a problem, because then we've ended up with an equilibrium, and then the cell, the neuron, could get stuck. So now we've got to pump out that excess sodium that's inside the cell that's not causing a change to occur. And that's where that sodium and potassium pumps come into play. So at rest, there's always going to be more sodium on the outside and more potassium on the inside. Now, during a phase of stimulation that a nerve is getting ready to be used, more sodium is going to be coming into the cell, and as that's happening, more potassium is leaving. So when those pumps pump that excess sodium out and pump the excess potassium back in, then homeostasis has occurred. It's a very quick process. And definitely understanding that that negativity on the inside is when the cell is not doing anything. So we have Manee getting his sodium, okay, the sodium was the outside, Manee's getting on the inside, potassium is coming out, okay, and I'm having that information relayed down, okay, to the end part. Now, in the world of neurons, it would be the axon, okay, the tail, okay, of the axon that would connect up to another neuron, okay, we'll pick on George, another neuron, okay, and that is going to, of course, relay information. Now, that relaying of information that we're talking about is a message. Now, remember, messages are done in the body chemically wise. Okay, so the chemicals that we're talking about are these things called neurotransmitters. Now, neurotransmitters, the common ones are norepinephrine, okay, serotonin, dopamine, and ACH. Okay, so ACH, of course, is that neurotransmitter that we talked about with the muscular junction, okay, that communication. Now, it's very important to think of neurotransmitters that they were only released when one neuron is talking to another neuron, or a neuron is talking directly to that effector organ that is going to affect. And that is when it's only released. Now, things about that, as far as where it's happening, is the word called synapse, okay, or junction. So a synapse is a junction, the connection of two areas of where the neurotransmitters are going to be released. Now, when you're thinking about synapses, it's important to remember that a synapse can only happen after that electrical current has gone from point A to point B. If it does not go all the way down that axon to the synapse, then the neurotransmitters will not even be released. Now, neurotransmitters help in two ways. Okay, either they assist, okay, or stimulate, or they inhibit what that neuron or that other cell is going to do. Now, the next part of the video I want to talk about is the spinal cord. Now, the spinal cord is going to be about the size width of your thumb, Okay, it is coming off of your brain stem, more precisely the medulla oblongata. It either ascends or descends, okay, as far as its tracks. So ascending, of course, would be going and sending information up to the brain, and descending would be bringing information down from the brain. Now, there are 31 pairs, okay, so if you like Baskin Robbins, I'll throw it out there, go get you some ice cream, and know that there are 31 pairs named according to the vertebrae that they're being protected by, okay, so those vertebrae, cervical, thoracic, lumbar, sacral, and coxal, okay, coccygeal region, okay, so 8, 12, 5, 5, and 1. So you add those numbers together, there's your 31 pairs: cervical, thoracic, lumbar, sacral, or sacrum, and coccygeal. Okay, so the spinal nerves come off the spinal cord. Okay, so like think of the spinal cord as your tree trunk, and the spinal nerves be branches. You got one main branch, okay, and then you have other little branches that come off of that. Now, in the case of the spinal nerves, those branches are called plexuses. Now, you have 3 main plexuses, so 3 main branches that the other major nerves are going to come off of: cervical, brachial, and lumbar sacral. Now, off of those, that's where you're going to find and have to worry about problems that can occur, such as damages to those individual nerves, but even more so if you were to damage the plexus. Now, the cervical plexus supplies those neurons when we're thinking about the areas of your neck, or those muscles, and the back of the head. And one of those nerves that come off of that region is very important when we think about breathing, is the pharynx nerve. Okay, that is what activates, gives life, innervates our diaphragm. Okay, so think about if you were to have a cervical injury. Okay, think of even spinal cord. If I cut the cord, then I'm usually cutting the nerves that come off the cord. Okay, so if I cut the tree down, the branches are going to come with it, that it would affect your breathing if it was within that cervical plex. Now, the brachial plex is going to affect your shoulder, your arm, your forearm, your wrist. You can kind of see the whole arm. Okay, and one of the major nerves that runs in that area is the median nerve. Okay, that could be, if you have a brachial plex impingement, that could affect, we think about carpal tunnel with that nerve. And the last is your lumbar sacral plex. Okay, and this is the one that, of course, supplies the lower, the pelvis, and the legs. And the biggest one, I think a lot of us know, of course, we think about with the branches, the largest branch coming off of this plexus is sciatic. Okay, the sciatic nerve. And of course, this one is going to extend all the way down. You can cause problems to the bottom of your foot. So definitely look through and understand and look at. I just covered kind of the basics of the different nerves. Definitely know that the nerves, individual nerves themselves, comes from the main plexuses, the main branch, and often the main branch goes back to our individual spinal nerves, and then from that is connecting to the spinal cord. Now, there's a name called dermatomes, and that's the map, okay, that helps a doctor determine whether you've got some impingements, you get damage to a spinal cord, spinal nerves, and dermatomes, that name is going to be just giving them different regions to the innervation that each one of those spinal nerves innervate. Okay, again, that word means give life to. Now, one thing to also know about your spinal cord and those spinal nerves is spinal nerve does a lot of innervation of the skeletal muscles as far as their movement, but also the spinal cord can do what they call a reflex. And a reflex is just a quick action, allowing it to not have to, like small things in our body that the brain does not necessarily have to control. So some of those reflexes we think about when you go to the doctor and they were to, hit your knee and your leg kicks out, or if you were to touch something sharp and then your hand pulls away from it, that is just that kind of that loop that goes to your spinal cord and then comes back to that effector, that muscle, to make a change. But again, most of the reactions that happen, okay, as far as we think of the spinal cord, are controlled by the brain, but there are some small reflexes within our body that does not need the brain's input directly. Fast actions, okay, that need to occur. Now I'm just going to mention here a little bit about the spinal cord and spinal nerves, such as the clinical aspect of it. Now we think about medical procedures, definitely knowing the length of the cord would be important, so what the epidural space, if an epidural was given, okay, that's important to understand. Of course, remember that we also have those meninges that protect our spinal cord, so it's a lot like the brain. Would be important to understand. Okay, so other things that occur and happen with the spinal cord, we definitely think about the severing of the cord itself. Okay, when we think about spinal cord injuries, we think of the pelagics. Okay, so definitely understand paraplegic versus quadriplegic. Para is 2, okay. Quadric would be quad, of course, would be 4. Okay, so different type of pelagics. Now, other things that can happen as far as diseases, when we're thinking about breaking apart, you can have autoimmune diseases. It can be a degeneration type of disease, or it can be an infection. Okay, now we think about diseases, multiple sclerosis. Of course, we think about that relating to the neurons, but of course, when you're thinking about the cord, we're thinking about neurons. Okay, so multiple sclerosis is one that falls under an autoimmune disease. That's where that myelin sheath coating is deteriorating. Of course, that can come from also the Schwann cells or the oligodendrocytes not protecting the neurons itself. Now, other diseases you can think about, some itises, some inflammations, okay, that could come from viruses, okay, that could directly affect the spinal cord. Tumors that could occur and happen within, of course, the cancer aspect of the spinal cord. Now, when we think about the cord, remember the cord is a part of the central nervous system. So kind of back to the beginning of the video when I talked about central nervous system versus peripheral. So central nervous system relates to anything that affects the brain and the spinal cord directly. Okay, so think about severing the spinal cord. Now the nerves are considered to be a peripheral nervous problem. So they are kind of different when we think of the diseases. So a peripheral nervous problem, okay, that affects the spinal nerves, not the spinal cord directly. So we think of the neuropathy problems, okay, so any disease that affects the nerves, okay, the neuropathic type of problems, neuritises, okay, the itis, of course, inflammation of a nerve itself. Now, carpal tunnel would be an example. Sciatica would be an example that we think about irritation or pressure. You could even get into, when you're thinking about slip disc, a herniated disc, those would fall in the land of affecting directly the spinal nerves. Now, when you're thinking about infections, definitely viruses, a major one to definitely think about would be herpes. Okay, shingles, okay, of course Lyme disease could be another example that could directly affect the peripheral nervous system. And there are some autoimmune diseases we think about, especially with vaccines sometimes. Remember, neurons are not immune from being attacked, okay, or even attacking themselves or being attacked by our white blood cells within our body. So there are some certain conditions that affect more of the neuroglial cells, but also the neurons could be attacked themselves. Now, the autonomic nervous system are neurons that conduct impulses from the central nervous system to your heart, your smooth muscles, and the glands. And remember, all those glands that are made of epithelial tissue. Now, the job of the autonomic nervous system is to balance our body. Okay, so automatically helping with involuntary functions. Now, there are two different divisions of our autonomic nervous system. There's the sympathetic and the parasympathetic. Now, when you're thinking about the two different divisions, think of a yin and a yang. So a little bit of this, a lot more of this. Now, of the two that we want to be on a normal basis is more in the parasympathetic division, which is sometimes called rest and digest, or I've even seen it in textbooks of feed and breed. Okay, so being at peace, okay, the P for peace. It controls, hopefully, more of our daily activities, that everyday life that we have, and it counterbalances the sympathetic reactions that we should have, but sometimes we have them more abnormal. Now, sympathetic division is called the fight or flight. Okay, so I want to get away from the situation. Okay, I want nothing to do with it. I need to fight, okay, build up that courage to do that, or I just want to flee away. It's the emergency, the stress, okay, think of the S as sympathetic as a stress. It controls our visceral organs during exercises, so it has some good to it, but also when we have emotions, okay, such as anger and fear and hate and anxiety that are triggered, it can also have the same type of response. So when you're thinking of sympathetic in your daily life, think of turning up the dial. I have a lot more sympathetic. I don't want to be stuck there for long. But the problem we'll see in a couple more videos is when we're stressed, hormones are released, and hormones aren't a quick change. It takes a while for them to get out of our body. So like when you have panic attacks, you have anxiety, that, of course, think of what that causes when you take tests, okay, what that causes to happen within your body, such as the heart, involuntary, and can't control it. Now the body's turned up the dial of stress, and my heart rate's going to go faster. Of course, that causes my blood pressure to rise, okay, my pupils will dilate, okay, during a sympathetic nervous when it's turned up the dial. Sweat, your glands are all going to be turned on full force, okay, sometimes changing the thickness of the liquid that they are secreting. Now on the opposite, which we hopefully stay more in, is mind over matter, is parasympathetic. So think about your heart rate going back down to normal. Your blood pressure, of course, will follow. Okay, the blood vessels, okay, might even go from being constricted to dilating some. Your body digestion starts working normally. Being able to urinate, a part of that, contracting the bladder itself, you have to be at peace to pee, okay, to poop, okay. So the parasympathetic, you definitely, want to start understanding, where the fibers originate, okay. It's a lot more quicker connection between sympathetic and parasympathetic, okay, about where they are connected. So that control of the parasympathetic versus the sympathetic system, we need it on a daily life, such as we need to happen that, my kidneys are working, decreased activity when the house is on fire, okay? I don't need my digestive system, working when I need more energy sent to my legs, the skeletal muscles, so I can move faster. So it's kind of like it's diverting, okay, these areas of our body, the effects that are happening to these effector organs in order to keep me safe. But unfortunately, as we know, especially that we'll see with the endocrine system directly controls the autonomic nervous system. Okay, and with that said, when we're stressed on a regular basis and not controlling it, then our body is not in that homeostasis that it needs to be in. Now, the second part of this video, I want to talk about the brain, okay? Of course, I want to have a demonstration here to show you the parts of the brain. There are 4 divisions that you want to be aware of. There is, starting at the top, the largest part of our brain is the cerebrum. So 75% of all the neurons in the brain are held. It has 4 lobes, okay? The frontal, the parietals, the temporals, and the occipit or occipital. So 4 parts to your cerebrum. Moving on down, okay, in the middle, deeper inside your brain, is going to be an area called your diencephalon. Okay, the diencephalon has 2 main regions, the thalamus, and below that is the hypothalamus. Then below that, so inferior to that, is going to be the brainstem. Okay, the brainstem is going to have 3 areas. We're going to have the midbrain, the pons, and then the tail. The bottom part of your brainstem is called the medulla oblongata, that descends as your spinal cord. And then the last of the 4 main regions of the brain is in the back, okay, right below where your occipit would be, your occipital region, and that is going to be the cerebellum. Now, also I'll talk about the coatings that protect the brain, so definitely important to understand that you have many things that hopefully protect your brain from getting damaged directly, such as the skin, the skull, these connective tissue membranes, and hopefully these barriers that protects the brain tissue directly. Hello students, so within this demonstration I used a couple things that you can get at your local dollar store, such as some Play-Doh, skeleton head, and I've cut open, as you can see, this skeleton head, okay, here, and then I took some foam So you put like flowers and stuff in. And I'm going to cover this into the head we will go to give the different parts of the brain. Okay, so let's go through these one by one. So definitely some things I'll kind of push them aside to be important when you're thinking about the cranium is the different parts. So we're going to look at the main areas of the brain, and the first one we're going to start with is the biggest part of your brain that has 4 lobes called your cerebrum. So the cerebrum is going to be your frontal in the front, your parietal on the top, on the side would be the temporal, on the side would be the temporal, and then if you lift it up a little bit in the back there with the pit set, the occiput or occipital region. So 4 areas that we're going to use our Play-Doh to put on inside of our brain. So here's the brain that I've pulled out from the skeleton that I've labeled with various colors that relate to the areas of the brain. So the first area we're going to look at, there'll be 4 lobes, is called the cerebrum. Now the cerebrum is the major part of your brain. So the 4 lobes are going to be in purple, is going to be the frontal, the parietals, which would be the blue, on the top of your head, the occiput or occipital is the green at your back, and then this yellow color is going to be your temporal lobe of your cerebrum. So definitely know the 4 regions of the cerebrum. Now here is what each one of these areas is going to do. So this region, the frontal region, which is on the front, so such as you would to smack your forehead, is going to be in purple and is going to have the following features. The frontal lobe is the motor area. This is where we're going to find our personality, our behaviors, our emotional expressions, our intellectual functions. You could also call it the CEO of the operation. Also, it's a place where memory is going to be stored. Now, one particular spot of this is going to be the Broca's area, and that's going to relate to speech and being able to say words effectively. Now, the next area we're going to look up is the parietals. Okay, would be on the top of the cranium, the most superior part lobe of your cerebrum. Now, this area is going to relate to sensotomatic sensatory, so such as from your skin and muscles. There will also be parts that can relate to taste, speech, and reading. So this area here is going to connect all of the other areas as far as our senses. Now, the back area, the most posterior, is the green. Okay, the green is going to relate to our occiput region. Now, again, it would be the back. If we put the back of the skull on, it would be the very back section. Now, this area is going to relate to vision. So you're going to see vision problems. If there's damage to this area, it's also going to help us judge distances and seeing in 3D. And the last of our 4 of our cerebrum in the yellow, okay, we'll talk about these 2 areas here in a little bit, but this yellow area, okay, is going to be the temporal region, okay, like where your ear would be. It's going to relate to hearing, smell, taste, memory storage also, and part of your speech area. So definitely important to go ahead and start understanding now when we come to the senses that we'll be talking about in the next video of what area of the brain it could be affected if we were to have an injury and how that will relate to the senses. Now the next area that you saw that was inside, okay, I know I have it on the outside because obviously you couldn't see it if I put it deep, but these 2 areas are going to be deeper to your cerebrum. Okay, again, cerebrum is, again, the largest part of your brain, but this area is deep to that, and it's going to be called the diencephalon. Okay, the diencephalon region has 2 main areas, the thalamus and the hypothalamus. So let's talk about the thalamus for just one moment in the diencephalon region. It's a relay structure. Okay, it helps us process most of that sensory information going to the cerebrum. Okay, so it connects all of this part also too. Now, the very important part of the diencephalon, hence when you would die without your diencephalon, but this particular part we'll look at a little bit obviously within this video, but when we talk about the video that I'll have in a couple videos talking about the endocrine system, there's a little gland that's going to come off of that that's going to secrete a lot of hormones. So definitely know your hypothalamus. It is part of the autonomic nervous system. It helps to regulate your temperature, your water balance, helps with thirst, appetite, emotions also too, but it regulates and controls functions of the endocrine system. It's very, very important. Definitely want to know the hypothalamus. Now the next part of the brain is going to be the brain stem. So we have midbrain, pons, and medulla oblongata. So midbrain, let's look at the pink one here. So the midbrain is going to regulate information, both sensatory and motor. And it's also going to help with some of our visual and auditory reflexes. Okay, so it's going to work with the autonomic nervous system. Now the next area below that in the red is going to be the pons. So kind of think these a middleman in some way. It's going to relay information such as sensatory motor also, but it also helps with respiration, breathing. And then last but not least, which is very important because it descends as your spinal cord, is the medulla oblongata. The Water Boy. Okay, so if you've never seen that movie, go watch that part, The Water Boy, medulla oblongata. So this is going to help with vital functioning such as our heart rate, our blood flowing, our blood pressure, respiratory, reflex such as coughing and sneezing and swallowing and vomiting. So you can see all those reflexes that we have in our body are going to relate back to the medulla oblongata, which descends into our spinal cord. Now there's one more part that I have added. Did not want to forget one more major area. This purple area here at the back, the most inferior and posterior part of your brain, is going to be the bell, the cerebellum. And the cerebellum is going to help with fine motor skills. So very important. Definitely want to know what the cerebellum does. It helps to maintain our balance and our muscle tone. So major areas of the brain. So definitely know the four lobes and what they do. The diencephalon, the brainstem, and the cerebellum. Those are the four main regions of the brain. Now there are three other structures that are also associated with the brain. The first one being the limbic system. Now the limbic system is called also the emotional brain. So with the limbic system functioning, we think about our emotional states and our behaviors. Again, areas that we're talking about, again, the cerebrum and the diencephalon. Okay, within those two areas would be the limbic system. So definitely want to know that. Now extending through the entire brainstem and the diencephalon is going to be a region that is called the reticular formation. So the reticular formation is going to help alert the cerebral cortex of incoming sensatory information. Its primary motor function is to regulate your muscle tone and to give the state of muscle contractions throughout your body. So again, diencephalon region, think about the jobs that those areas have, and the brainstem communicating together. Now also, a portion of this is going to be our RAS system, reticular activating system. So think about sleeping and being awake, the coma state. This is also where we're going to find our REM sleep, rapid eye movement. The only time that your brain cleans itself, totally reorganizes stuff, is when you get in true REM sleep. This is also the time that we'll find such as dreaming would occur. And then one more area is called the basa nuclei. This is what's going to smooth out and coordinate muscle skeletal activity. So this would be the area that they are concerned with when we end up with protein clumps in conditions such as Parkinson's. So another thing to consider when you think about the brain is the 4 layers of protection to protect our brain tissue. And remember, a group of cells coming together makes the tissue. So remember, we have various tissues throughout different systems in our body. So bones would be the first layer of protection. So definitely think about those bones that we talked about. So if you have not watched that video, make sure you watch the video of the skeletal system. Then the next layer we have are meninges. Okay, so when you think about these areas, think about laying layers of connective tissue over top of them. So there are 3 different layers of meninges that help to protect, and they are connective tissue. The first layer is the pia mater, that's touching the brain directly, again covering the whole brain. The arachnoid matter, and below that layer is going to be the cerebral spinal fluid, which will be our 3rd layer we'll talk about here in a second. So pia mater, arachnoid matter, and the last coating is the dura mater. Alright, to help you visualize that, I got some paper towels. You can do this yourself and cover the different layers to protect the brain. So the pia mater is first. The arachnoid matter is second. And then thirdly is our dura mater. And these are 3 layers of protection. Now, below the arachnoid matter and before it gets to the pia mater is going to be some fluid. Now the cerebral spinal fluid is going to help protect and cushion the brain, such as like if we hit our head against something. Okay, it's going to be that liquid that's going to help to cool down the brain and also our spinal cord. So definitely know the 3 meninges, and these are what these are referring to, protecting the brain and the spinal cord. Now the last layer of protection is a wall called the BBB. Okay, not Better Business Bureau. It's referring to the blood-brain barrier. And this is an arrangement of cells that come from one of those glia cells that I talked about, or neural glial cells, called the astrocyte. So the astrocyte cells are going to act as a barrier of movement across potentially harmful chemicals into the central nervous system. Now, think about, of course, when you think about diseases and protection, think if something got past, okay, all of these layers and it could directly affect the brain. Okay, and of course, once the brain tissue, then we think about all those neurons and all those neural glial cells. So this is just one more protection that sits on top of this to give more protection to the brain tissue. Remember, as many walls as we can put between tissue, the better and safer that our brain and the tissues will be. Now, since we've talked about the brain, now we need to talk about the cranial nerves that come off of the brain. Now, there are a total of 12 cranial nerves that you're going to see here in a few minutes on a demo, and I want to talk about the areas that they are going to innervate and affect. Now, of the 12, 1 pair of them extends from the cerebrum, so remember those 4 lobes. 1 pair extends from the diencephalon, so remember the hypothalamus-thalamus region. And then the other 10 pairs extend from the brainstem. Now, very important when you're thinking about cranial nerves, definitely remember that you're also talking about Roman numerals. Okay, so from the, looks like an I, all the way up to the XII, okay, which would be 12. Now, of those, remember, they do not come out of the brain in the exact order from 1 to 12, but it is definitely important to learn them in the correct order from 1 to 12, okay? That way it can definitely help you. Now, the 12 names you're going to see is olfactory would be number 1, and that's going to carry impulses to your nose. So remember, you have 1 nose. Number 2 is optic. Okay, you have 2 eyes, so optic nerve is number 2, and it carries impulses from the eye to the brain for vision. Number 3, number 4, and number 6 are going to relate to the same thing that they affect, which is going to be your eye muscles. So the octomotor, the trochlear, and the abductans. Okay, so number 3, number 4, and number 6 will go together to help to move the eyes either externally or internally. Now, we skipped number 5, okay, so don't forget it. Number 5 is trigeminal. Okay, that's going to help impulses to your eye. It's going to help your jaw, so it's going to help with chewing. Now, number 7, okay, remember, because we already talked about number 6 with the eye movement. Number 7 is going to be facial. Okay, so facial controls the muscles of facial expression, carries sensations of taste, stimulates a small salivary gland, and helps with your tear ducts. Now, moving on along would be number 8. Okay, so number 8 would be the next one. That's called the vestibule cochlear. That's going to help with balance, and it also helps with hearing, so it affects directly your ear. Now number 9 would be the next one. Okay, number 9 is called glossopharyngeal. So gloss means tongue, pharynx is your throat. Okay, so like if you were to wear a mask, that would be right behind your nose and your mouth, and your larynx, that region is your throat. So it carries impulses from your tongue, your throat. It helps with swallowing, so it's our swallowing muscle. And it helps to also stimulate the largest of our salivary glands called the parotid. Now number 10 is the most important because it's the weird one. It wanders away, meaning it affects your thoracic and abdominal cavity. So think of all those muscles in the thoracic and abdominal cavity. And it carries motor impulses to also the voice box and the throat region. It's called the vagus nerve, number 10. Now number 11 is the next one. Don't have enough fingers for that one. Okay, so the accessory number 11 controls the neck and your larynx, the muscles, okay, in those regions. And last but not least is our hypoglossal. Okay, gloss means tongue, below the tongue, so this controls the muscle of the tongue. Now, when you are thinking about, here in a second, you're going to see the demo that's going to show those cranial nerves. And when you're watching that video, I definitely want you to also be thinking about when one of those areas is damaged, that it will directly affect that sense, either to or from the brain. Now, here's the demonstration. So now we're going to look at the brain, and you'll notice a couple things about this demonstration. Of course, there's the cranium. So if you open up the cranium, we have the brain and all the parts. Now, I'm not going to focus on this video at precisely where these come out. The Roman numerals are going to relate to how that the 12 cranial nerves exit the brain. Now I'm going to put them in order, even though they are not in order how they exit the brain, far as the yellow part is going to relate to the nerves. Now I've only put a couple of these nerves on here. There are 12 of these nerves that come out of the brain that innervate, meaning they give life to mostly in the cranium, okay, so mostly in this guy, but there is one of them we're going to look at that does extend down and controls the thorax and the abdominal pelvic region. So I want to go through them individually here and tell you what they do. And again, they're in order here, but again, you definitely need to know that they do not exit the brain in this order. Is cranial, and when you see the CN, that's standing for cranial nerve, number 1 affects your nose. Okay, now carries impulses for the sense of smell towards the brain. It's called the olfactory. So think about when you're going to a factory, the smells that you would have. That is your cranial nerve number 1. Now cranial nerve number 2 is the optic. Okay, so optic is eye vision. Okay, so number 2 carries visual impulses from the eye to the brain. Now the next ones, and I group them together because they are important, because they do work independently but do affect the same thing, is number 3, number 4, and number 6. Okay, so number 3, number 4, and 6 all work together to affect the eye muscles. So number 3 is octomotor. So think of IC, okay, in some ways to kind of help you. This controls contracting of the eye muscles. Okay, so when we look at in the next video when we talk about the iris. Okay, so definitely be thinking about those particular regions. That would be number 3. Number 4 is the trochlear. This is the one that supplies one eye muscle. And then lastly, number 6, abductans, is going to control an eye muscle also. So put those 3 together to know that they control the eye muscles. Now we skipped one in that, and the one that we skipped was the trigeminal, number 5. That helps also with chewing. Okay, so definitely be thinking about when, as I'm going through these 2, of disorders that would be affected if we damage the cranial nerve. So the trigeminal carries sensory impulses from the eye. So it does affect the eye also too, the upper jaw and the lower jaw towards the brain. So it's going to help you to chew. Now facial would be number 7. Okay, remember we had to kind of skip by number 6 there. So facial is going to affect, of course, the face. Okay, so it controls your muscles of facial expression. It carries the sensation of taste, stimulates your salivary glands, and actually helps you to cry also too. So in the facial region. Now moving on along, so our next one is number 8. It affects the ears. Okay, it's called the vestibule cochlear. Okay, and you'll kind of understand that when we talk about senses, because there's 2 areas in your ears, the vestibule region and the cochlear. One is about balance and one is about hearing. So this is the one that carries sensory impulses for hearing and equilibrium from the inner ear towards the brain. Now moving on along, we have one called glossopharyngeal. Okay, so gloss means tongue. Pharyngenical means throat region. So this one's affecting swallowing. Okay, so this one carries sensory impulses from the tongue. And the pharynx, which is your throat, it controls the swallowing muscles and stimulates. It helps to stimulate your parotid, and that's one of your salivary glands. Now, this is the one, the very important one that you definitely need to know. And I would have talked a lot about this in the video when we talk about the autonomic nervous system. So number 10 is the vagus. Now, sometimes I call it vagus, okay? But vagus nerve is the only one of the 12 that called the wandering nerve for a reason. Okay, now I know you can't exactly tell in that particular picture there. That little tiny picture is of the body. Okay, so it is the one that carries most and supplies the organs of your thorax, the abdominal cavity, also carries motor impulses to the voice box, your larynx, and to your throat. And the last 2 that they're not been forgotten about because they are definitely important also is the accessory. Okay, number 11, accessory affects your neck, okay, muscles. So this is the accessory muscles of the neck and the larynx. The neck and the larynx, your voice box. And then last but not least, our hypo means below, gloss, remember, meant tongue. So number 12 affects our tongue, the movement of our tongue, the muscles directly. So hopefully this helps you. Definitely use something, okay, whatever it is that you want to use. Again, remember, each of these nerves come out and innervate different parts. Most of them stick to this guy here, okay, inside of here, but there is that one, the vagus, number 10, that definitely affects a lot of the autonomic nervous system. Now that we have talked about the brain and the spinal nerves, definitely be thinking about the disorders that affects the brain directly, and of course the accessory structures, the nerves. Now when you're thinking about disorders and diseases, of course the high one that you'll think about first when you think about brain is of course conditions like Alzheimer's, but don't forget the other ones, okay, such as epilepsy, which is any type of seizure that would cause the brain to cause muscle spasms and even loss of consciousness in our body. So it's any type of abnormal activity in the brain that could cause a seizure. Now we have inflammations, all the itises, okay, one of them being, of course, meningitis, okay, and that itis, of course, affects the meninges, okay, the protection of the brain. And of course, you can get inflammation of just the brain tissue itself. Now we can get cerebral spinal fluid, water on the brain, okay, that hydrocephalus, okay, think of hydro means water within the brain. Now the big one that we think about blockages when we come to the blood system is a cerebral vascular accident, okay, CVA, which is also called a stroke. Now 2 ways that can happen. It could either be a blood clot, preventing blood getting to the brain, or a hemorrhage in the brain that causes the same type of action, which is called ischemia. And ischemia is when we're not getting proper blood flow to a tissue, and then eventually those cells die. Now other things, of course, tumors, benign and malignant, could also affect. So if you had a tumor in one of those areas of the brain, it could affect what that particular area of the brain would do. Now there's been a lot in the news here lately. We've heard about, traumatic brain injuries, especially with football players and all the problems, of course, that can come from that. With that, that's when you get into which we classify as true degenerative diseases, okay, of the brain. So we think about Alzheimer's, dementia, that kind of umbrella term. That can be, of course, we're thinking about the cerebral cortex, even the hippocampus breaking apart. We also think about maybe having clumps of proteins within the brain that can definitely cause memory loss and some hallucinations, okay, such as conditions that we also think about with Parkinson's. And even within Parkinson's, we have the problem where the neurotransmitters are not communicating. Okay, remember the manatees must talk to each other. Well, remember neurons got to talk to each other. And if they're not communicating via the neurotransmitters, then those things will not do what they need to do. So hopefully within this video I've got to use everybody today for as my manatees. Within this video that you've learned that the importance of the nervous system, the complexity, and obviously I'm just kind of scraping the surface when it comes to the complexity. So definitely put that extra time into your textbooks and make sure that you're taking extra times to kind of absorb all these different parts that makes up our nervous system. Don't be nervous about it. If you do, get you a manatee and hug on to it. And know that the nervous system, it should not make you nervous. It's a vital part because it will control every organ system that we will talk about into future videos. I look forward to seeing you all in the next video.